A 30-year-old lady presents to the outpatient department with an erythematous butterfly rash on her cheek. Which of the following antibodies should be assayed initially for her suspected condition? Anti-dsDNA. Anti-nuclear antibody specific for SLE is anti-dsDNA. Drug-induced lupus antibodies are found in anti-histone antibody. LE cell, that is lupus erythematous cell, is a neutrophil monocyte. Hematoxylin bodies are seen in SLE. Features of systemic sclerosis are calcinosis, sclerodactyly, and Raynaud phenomenon. All of the following are features of scleroderma except calcification in long bone. So what are the features of scleroderma? Dysphagia, Raynaud phenomena, and skin contracture. A 35-year-old lady complains of dysphagia, Raynaud phenomenon, and sclerodactyly. Investigation shows antinuclear antibody. The likely diagnosis is systemic sclerosis. Anticentromere antibodies are most commonly associated with CREST syndrome. Sicca syndrome is associated with all except midline granuloma. So Sicca syndrome is associated with chronic active hepatitis, rheumatoid arthritis, and scleroderma. All are seen in primary extraglandular Sjogren syndrome except rheumatoid arthritis. So what is seen in primary extraglandular Sjogren syndrome? Raynaud phenomenon, lymphoma, and splenomegaly. Uveitis is seen in sarcoidosis. Autoantibody in Sjogren syndrome is anti-RO and anti-LA. In an immunocompromised patient, what is correct? T cell deficit causes pyogenic bacterial infection and B cell deficit causes capsulated bacterial infection. Lack of leukocyte adhesion molecules LAM is associated with delayed closure of umbilical cord. Which one of the following statement is correct regarding chronic granulomatous disease? Nitroblue tetrazolium test is useful for screening of chronic granulomatous disease. Nitroblue tetrazolium test is used for phagocytes. All are true regarding gamma globulinemia except normal cortical lymphocyte in paracortex and medulla, and decreased red pulp in spleen. So what is true regarding agammaglobulinemia? Loss of germinal center in lymph node and immunodeficiency cell mediated. The commonest primary immunodeficiency is isolated IgA immunodeficiency, which is found in De George syndrome, tetany, and mucocutaneous candidiasis. Thymic hypoplasia is seen in De George syndrome. Wiskott-Aldrich not true is raised IgM and reduced IgA is not true. What is true is raised IgE and CD4 and CD8 defect. IgG is normal or slightly reduced in all except Wiskott-Aldrich syndrome. So IgG is normal or slightly reduced in selective IgA deficiency, De George syndrome, and common variable deficiency. Adenosine deaminase deficiency is seen in the following: severe combined immunodeficiency. All of the following is true except in Bruton's agammaglobulinemia, opsonization is not affected. So what is true is NADPH oxidase acts via superoxide ions. Chediak-Higashi syndrome is due to defective phagolysosome formation, and myeloperoxidase action is mainly due to OCL. Common variable hypogammaglobulinemia shows normal B cell count. Which of these is a characteristic of amyloidosis? Beta-pleated fibrillary congophilic. Major fibril protein in primary amyloidosis is AL. In multiple myeloma, amyloid is AL. Amyloidosis is found in the following except thymoma. So amyloidosis is found in multiple myeloma, hypernephroma, and lymphoma. AA amyloid chain is found in rheumatoid arthritis and familial Mediterranean fever. Which of the following is heredofamilial amyloidosis? Familial Mediterranean fever and systemic senile amyloidosis are heredofamilial. True regarding amyloidosis are all except none. So what is true is massive proteinuria, mild hypertension, normal kidney size, and urinary cast is present. All of the following statements regarding amyloidosis are true except renal amyloidosis shows A type of deposit is false. What is true is multiple myeloma shows L type deposit, secondary amyloidosis shows A type deposit, and renal amyloidosis commonly present with mild proteinuria. Lardaceous spleen is due to deposition of amyloid in sinusoid of red pulp. What is most common cause of death in amyloidosis? Cardiac failure. Best investigation for diagnosing amyloidosis is rectal biopsy. On electron microscopy, amyloid characteristically exhibits 7.5 to 10 nanometer fibrils. Amyloid deposits stain positively with all of the following except methanamine silver. So amyloid deposits stain positively with Congo red, crystal violet, and thioflavin T. Stain used in amyloidosis are Congo red, thioflavin, and PAS. Which one of the following stain is specific for amyloid? Congo red. A diabetic patient is undergoing dialysis. Aspiration done around the knee joint would show a beta 2 microglobulin. A 60-year-old female is suffering from renal failure and is on hemodialysis since 8 years. She developed carpal tunnel syndrome. Which of the following will be associated? Beta 2 microglobulin. Hemodialysis associated with amyloid pattern. Beta 2 microglobulin. Correctly matched pair in amyloids, multiple myeloma, light chain, chronic inflammation, cardiac ATTR. Familial amyloidotic polyneuropathy is due to amyloidosis of nerves caused by deposition of mutant transthyretin. What is true about senile systemic amyloidosis? Transthyretin. Which type of amyloidosis is caused by mutation of the transthyretin protein? Familial amyloidosis, polyneuropathy. Amyloidosis is most commonly type 2 diabetes mellitus. In amyloidosis, beta pleated sheet will be seen in X-ray crystallography. Amyloid is found in medullary carcinoma thyroid. Bone marrow in AL amyloidosis shows bone marrow plasmacytosis. In hemodialysis associated amyloidosis, which of the following is seen? Beta 2 microglobulin. Senile cardiac amyloidosis is associated protein as transthyretin. Which of the following amyloid form is seen in secondary amyloidosis associated with chronic diseases? Amyloid associated protein. Most common cause of death in primary amyloidosis is cardiac failure. Rh incompatibility is type 2 hypersensitivity. Confirmatory test for the diagnosis of amyloidosis is rectal biopsy. The primary function of toll-like receptor is activation of immune system. Best marker for SLE is anti-dsDNA antibody. HLA is present on short arm of chromosome 6. Anti-U1 RNP antibody is seen in MCTD. Granulomatous inflammation is which type of hypersensitivity? Type 4. Staining characteristic used for demonstration of amyloid is apple green with Congo red under polarized light. Immune complex deposition is type 3 hypersensitivity. Diffuse proliferative glomerulonephritis and lupus nephritis falls under class 4. Congo red with amyloid produces brilliant pink color. Onion peel appearance of splenic capsule is seen in systemic lupus erythematous. Lardaceous spleen is due to deposition of amyloid in the sinusoid of the red pulp. Amyloid AA originate from reticuloendothelial cell. Secondary AA amyloid is seen in all except multiple myeloma. So secondary AA amyloid is seen in rheumatoid arthritis, tuberculosis, and renal cell carcinoma. Most commonly, amyloidosis is secondary to chronic suppuration. Congo red with amyloid produces brilliant pink color. Lardaceous spleen is seen in amyloidosis. Biopsy of the parotid gland in a patient with a Sjogren syndrome shows lymphocytes. Which of the following cells do not act as antigen presenting cell? T cell does not act as antigen presenting cell. They are B cell, macrophages, and osteoclast. Anti-tumor activity is shown by all except basophil. So anti-tumor activity is shown by cytotoxic T lymphocyte and natural killer cell and macrophages. Large antigen antibody reaction is required to cause Arthus reaction. Hemolytic disease of newborn is an example of type 2 hypersensitivity. Immune complex deposition is type 3 hypersensitivity. Mast cell release interleukin 1, 3 and 4. Which of the following do not play a role in production, maintenance and activation of lymphocyte? Interleukin 12. Which of the following antigen does not express MHC class 2 molecule? Follicular cell thyroid. So which antigen cells express MHC class 2 molecule? Microglia of brain, Langerhans cells of skin, dendritic cell of lymphoid cell and fibroblast of connective tissue. All of the following are immune complex disease except graft rejection. So which are the immune complex diseases? Serum sickness, Palmer's lung and SIB. Commonest fungal infection in neutropenia is Candida. A patient with recurrent bacterial infection is diagnosed to have a genetic deficiency in myeloperoxidase. The cause of increased susceptibility to infection is an inability to produce hydroxy halide radicals. Pre-B cell and B cell are produced in bone marrow. Th1 type of cell are most dependent on IFNY. Humoral graft rejection is characterized by thrombosis of the blood vessels and ischemic necrosis. The type of immunological reaction seen in endothelial corneal graft rejection is type 4. In the rejection phenomenon after kidney transplant, the primary target for early immunological attack is vascular endothelium. Acute humoral renal transplant rejection is characterized by the following except interstitial and tubular mononuclear cell infiltrate. So what is seen in acute humoral renal transplant rejection? Presence of anti-donor antibody, necrotizing vasculitis and acute cortical necrosis. Acute graft versus host disease reaction occurs in all except adrenal. So it occurs in liver, gut and skin. The LE cell in Romanovsky stained preparation is monocyte neutrophil. Antinuclear antibody in SLE cause LE cell. The most diagnostic test for SLE is antibodies against DNA. The most sensitive test for SLE is ANA, that is antinuclear antibody. Urine finding in SLE is proteinuria and RBC cell. Renal pathology in SLE include all except lipoid nephrosis. So renal pathology in SLE includes focal glomerulonephritis, diffuse glomerulonephritis, membranous glomerulonephritis. What is the most common histological type of nephritis seen in systemic lupus erythematosus? Diffuse proliferative.